Hi, I'm Dr. Adam Fields. I'm a chiropractor. Welcome to Health and Care. Scoliosis affects 1 out of 25 people. It is an epidemic, and it is very challenging to help. The surgeries are not that great. The results can be bad. It can be a lifetime of pain, etc. And it's not necessarily a problem of the modern age. Hippocrates even wrote about scoliosis. He had different benches and ways of stretching the spine. He actually got into it a bit way back then. Well, today we don't have Hippocrates. We have Dr. Mike Janzen. And he is, if there was a Mount Rushmore for scoliosis doctors, he would be on it. This is not an easy thing to tackle. I am so fortunate to have Mike Janzen with us today. Mike, great to see you, doctor.
Hey, Adam, good to see you too.
Oh my gosh. So scoliosis, you've taken on Goliath, right?
Yeah.
You've taken on the most difficult thing in chiropractic, right?
Yeah.
And I'm thrilled to have you because there's so many times. I used to tackle scoliosis, and finally I found you. And so everybody that comes in, their family members might be coming to me, but I'm sending that one with scoliosis to your office because this is what you're geared to do. But let's familiarize our folks out there. What is scoliosis? What makes it so bad? We all heard this. We've heard this term scoliosis. Tell us about it.
Well, scoliosis is a curvature of the spine going from side to side. And what happens over time is gravity will pull on that spine and those angles that are going off to the side and make your spine degenerate and collapse and create those really bad postures that you see in older people by the time they're hitting 50, 60, 70 years old, and they're hunched over, their shoulders kind of go up on one side. And because of that, the pain levels start to increase. And it just gets harder and harder to treat successfully the older the patient gets and the larger the curve gets.
So we have lateral curves, which really there's a corkscrewing effect also, right?
Yeah, there's a torque, a counter torque. So half of your spine might go clockwise, the other half might go counterclockwise. And
Mm.
that creates a lot of tension and a lot of um, strain on your back.
It sounds like tension on the nervous system too.
Everything,
Hmm.
muscles, tendons, cartilage, your disc, your bones, your rib cage, everything gets torqued. Yeah.
Can organs be compressed and compromised in some way?
Definitely on the high curves. Yeah. So if
Mhm.
you get into that 60, 70, 80-degree range, it'll definitely affect your lungs, your heart. Um, yeah. So that can be a dangerous thing when it gets that high.
I've heard, I know it's controversial, but I've heard that the life expectancy is less with people with scoliosis.
Yeah. Again, it's the much higher curves.
Hmm.
The people with the lower curves in that 40, 30, 20-degree range, they deal more with pain syndromes and postural syndromes.
Hmm.
Yep.
So, when I was doing it, when I was working on them, it could get tricky. All of a sudden, it's just you're working on it, and oh, it flips out of control. Right? Wait, where'd that
Yeah.
other curve come from?
Yep.
And it can be quite a challenge. But um, you're working on pro athletes. You had kind of your typical, not typical, but chiropractic practice working on athletes. But you're working on professional athletes, and then you switched into this, right? Okay, I want to be the neurosurgeon of chiropractic.
Yeah.
Um, what made you switch?
I think it was seen that there was no solution for it. About 20 years ago when we were going into the sports chiropractic, there were a lot of people that needed our services because we were so unique. We did muscle and tendon therapies and extremity work. And as more and more people started getting qualified with that and doing active release techniques and extremity adjusting, um, that type of chiropractor did become a dime a dozen. And we kept getting a patient every now and then that we just couldn't fix. And it always came back to that scoliosis patient. And so it was actually my brother, Matt Janzen, who started looking at different therapies that the chiropractic profession had, that orthotists and medical doctors had. And we started to realize that no one was fixing these people. So not only were we struggling with these people, but everyone else was as well. And that kind of started our trek to look for better answers for these people. And that's kind of the nutshell of how we got into that.
And that's how I got more into my cranial work. Is people were coming in with sinus problems and allergies, and I heard about it, this treatment, and I started doing it, and boom, it led me into a whole thing. But
Yeah.
yeah, it's a need. You were filling a need out there.
Yeah.
And then but you go through it and you realize, wait a minute, what I'm being taught in this scoliosis care may not be working, or what these people are saying, these
Yeah.
technical peddlers, may not work.
Yeah. So we went down that road where we thought, okay, we're going to grab the top chiropractors around the country and learn their techniques and learn what they've discovered and pick their brains. And then we would replicate that back in our office. And we realized we weren't getting the consistent, predictable result that was promised. And that led us down the next road of, well, we got to find something better, or we got to take what they've done and make that better. We have to invent new things. And so we started seeing all these different needs and ideas in how to treat scoliosis.
So is your practice like is it a conglomerate of all these things, or has it morphed into the Mike and Matt Janzen technique?
Well, um,
I mean, people fly
it's
over a lot of chiropractors with a lot of techniques to get to your office, right? I know that you've had people from Kuwait, you've had people from different,
yeah, I think
Asia. You 130 or people come from miles and miles away.
yeah,
So why is that?
I think it's because we took what was, made it better, invented a few more things, and then got all the professionals that would help us accomplish that and put it in one location.
Hmm.
And so anything from flexibility to neurological to cranial to exercise to a brace, a good brace,
Mm-hmm.
and we put it all in one location. So a patient can come in and get just about anything with their scoliosis treated
Mm-hmm.
from start to finish, A to Z.
Mm-hmm.
And
So
that's what
before,
helps get us the good results,
right,
is having
you
that
have a
all in one
big
location.
toolbox all in one
Oh,
location.
yeah, definitely.
Now, what's the how do you catch this in time? Because I mean, you can help the spine. You can help spinal curves, like I help what's called, and you do, I'm sure, help sagittal curves, right? Where the head is forward and you bring
Yeah.
it back, or there's no cervical curve and you're putting a curve in there, and those can be fixed, right?
Mhm.
In as an adult, but a
Yeah.
scoliotic curve as an adult is much more difficult to work with. So your goal is to get the kids when they're young, 8 years old, 10 years old.
Yeah, the majority of scoliosis starts when you're a kid and people don't know it. And so um, the current system was doing scoliosis screens in your PE class in seventh grade, eighth grade. And the unfortunate thing with that is by the time you're 13 or 14 years old, the scoliosis has progressed to its largest number
Mm,
at that point, because scoliosis gets worse with growth. And so you might have a 15-degree curve in a 10-year-old, and it'll stay 15 degrees until they hit adolescence, let's say at 11 or 12 degrees or years old. And within the next 2 years, it can go from 15 to 45,
mm.
just like that. And so by the time they were catching it, it was already too hard to treat. And
Just
so,
just to let people know. So think about your spine. It's straight here, and then now think about it with a 45-degree curve in there, right?
yeah, yeah,
That's
the
a big
engineering
deal.
just, yeah, exactly. And so the Leaning Tower of Pisa is going to fall eventually. And
Right.
so
Imagine your
grab,
house was built on a 45-degree curve, right?
yeah,
The doors don't open, the cabinets don't
yep,
open, the things start wearing down, and that's what happens. Knees,
yep,
discs, facet joints,
yep.
legs, everything. I mean, everything starts wearing down.
And so what was happening was over the last 40 to 50 years is they would catch it too late and the kid would just end up in surgery anyway. And so a lot of the testing facilities were saying, why are we even testing nowadays?
Mm.
Because we catch it, but it doesn't change the outcome. And so they did that for 40 to 50 years. And now they're starting to give up, which is a travesty, because now new treatments are coming about to where if we can catch it, let's say at age 9 or 10, instead of age 13 or 14,
Mm.
you can really help that scoliosis and prevent that 15-degree curve from ever going up into severe range like 45.
Right, and you're literally pushing into their future. You're taking
Yeah,
that 80-year-old is going to be dancing at their grandkid's wedding instead of hunched over with a
yeah.
walker and oxygen or whatever, because of that little curve that you kept from getting to become a big curve.
Yeah, that's a good point, because keeping it at 15, a 15-degree curve under gravity is a huge difference in a 45
Right.
over 70 years of your life,
Mm.
right? Because gravity needs time. And so that 45-degree curve may not be painful at age 20, but it will at 35 or 50 or 80. And so if you can get that curve from 15 down to 5, the kids virtually got a straight spine going into adulthood, and that 70 years of gravity isn't going to affect their life like a 45. It makes a huge difference in their quality of life and enjoying life.
Hmm. It does. It does. It's wonderful what you're doing. So how is it that how is it this happening? I mean, a lot of people, they call it idiopathic, meaning we don't know why this is happening. Other people say it's genetic. Some people say it's adverse mechanical loads, that
Mhm.
maybe a misalignment, maybe vertebra that were formed in a poor way. Whatever. I mean, what is happening from all your experience?
Yeah. Well, to answer one of the questions just about genetics is there's a strong genetic component. And so if a grandmother or a mom has scoliosis, there's a good chance that one of the daughters might have scoliosis or one of the kids. And so that's really important to understand, that if you have an aunt, a grandma, a mom who has scoliosis, that's a really important thing to get screened and make sure that you catch it as small as possible, because it is growth driven. So you want to catch it early. And that kind of leads into what causes it,
Mm-hmm.
right? So there's a genetic component, but back in the 1960s, there was a Dr. Roth who wrote the first paper on what was happening. And basically, what he called it was uncoupled or asynchronous. And that just means not at the same time.
Mm.
Neuroosseous growth. So neuro means nerve, osseous means bone, and then growth. So basically, what he was trying to describe is your bones and nervous system in your spine isn't growing at the same rate.
Mm.
And what happens is, if the bones grow too fast, the nervous system can't be stretched continuously forever during that growth
Mm-hmm.
spurt. And so what happens is your body purposefully buckles the bones and shortens the distance from your brainstem to your sacrum, so your nervous system's not getting stretched too much, and that creates the coiled down scoliosis.
It's
And that's,
staving the spinal cord, basically.
yeah, it's your body's basically doing this to help you. The problem is, when you're done growing, your body doesn't say, "Hey, I'll put it back now." It
Mm.
leaves it there crooked.
Mm. So you literally have to do treatments to help the nervous system grow faster. Maybe you might even use nutrients,
Yeah, mechanical stretching,
mechanical
nutrients will do.
stretching of the nervous system.
Yeah.
Phenomenal.
Mhm. We'll do different lab tests and look at the internal parts of the kid and saying, why is that nervous system not growing at the same rate? There's always a reason why. It's just a matter of how much you want to dig. And so that
Right.
was the other part of our program, was no one knows why. There's got to be an answer. There's got to be a reason why this is happening.
Mm-hmm.
And so we scoured literature all over the world and found different things on myelin growth and things that stunt growth and stimulate growth. And so we found all of that and started creating a program to maximize a kid's nervous system development during adolescent growth.
So what would some of those things be? Like what kind of nutrition are we talking about to help the nervous system? And do you think that like the mom had some deficiency, or there's some familial deficiency, some enzyme that's not breaking down
Yeah,
something to get some vitamins, some.
yeah, definitely. And it's not just one thing, but to give one example would be um, well, a couple examples. One, I think some of the most common that we find is blood sugar and thyroid. And so thyroid binding globulin stimulates a lot of the nervous system development in myelin. And as a lot of people know nowadays, there's different autoimmunities to food, to dairy, to gluten. And what happens is kids at 9, 10, 11 years old are already getting antibody response to the thyroid and decreasing their thyroid production, which then leads to decreased nervous system development. And so that's one that we find a lot. The other is blood sugar. And, for example, the nerves don't have insulin receptors. And so if your blood sugar is running too high, you get too much sugar in the nervous system. Nerves don't like change, Adam, right? You put cold on a nerve, it goes numb. You put heat on a nerve, it goes numb.
Mm,
You put pressure on a nerve, it goes numb.
mm.
You put too much sugar, you put too little sugar in that nerve, it doesn't like it. And so that can stunt it. And usually it's a conglomerate of a lot of different things, like you talked about enzymes or genetics, and all of those things kind of hit that boiling point in that one kid to where the stars just aligned for them to get scoliosis at that point.
So we do have a radical increase in sugar in the last, 500 years. It's big. It used to be little vials of sugar on the, necklaces of kings and queens, and now it's,
Yeah.
pounds a year per person of refined sugar. We also have increased autoimmune disorders, right?
Yep.
They're trending right now in a big way. Do you think we're seeing more scoliosis? Do you think or do we have that number?
Well, we don't, because x-rays were developed about 100 years ago. And one of the reasons there's such a disagreement on how many people actually have scoliosis is there's really no pain when you're a kid with scoliosis.
Mm,
And so no one gets x-rayed. Or I should say, a lot of kids don't get x-rayed. They don't get diagnosed correctly.
right.
And so there could be a lot more people with scoliosis that just never got diagnosed until they get older.
Hmm.
And so it's difficult to track those numbers.
It is. It is. But you're here. I mean, it's like, can you
Yeah.
dig into every reason why it can't? I mean, you may not get the cause on everybody, but you've got the cure.
I have to be careful saying cure.
Okay. You can improve
It's
it.
Yeah, we can improve it. We can correct a lot of it and manage it. Definitely. Yep.
Right. Now, so that gets to how do you correct it? I mean, this is a big. We're talking about stretching the nervous system. We're talking
Yep.
about braces, I believe.
Yep.
What else? What are your big
So,
tools?
we have 5 main points that we will typically stick to. The first one is go after the root cause. And so if that nerve tension and that asynchronous growth is occurring in the bones and the nerves, then that's one of the first things that we go after. And so we will run the labs to figure out what we can do to stimulate nervous system development and mechanically stretch the nerves. So if you don't have that fire put out, at least a little bit or a lot, you can't really move on to the next sections of the treatment.
Mm.
And the next section is loosening up the spine. And so when spines start to grow into this curved and torqued position, the ligaments and the tendons and the muscles all grow short on one side and long on the other. So you have to start creating symmetry from side to side. And so you want to lengthen the short side and you want to shorten the long side. Does that make sense?
It does. It does. What's interesting is that from what I remember, there was a study on just regular chiropractic, right? These kids that were in school and they had scoliosis, they treated them throughout the school year, and when they were done with chiropractic school, they re-x-rayed and they're actually worse, right?
Yeah.
Did you hear about this, right?
Yes.
So
Yeah.
chiropractors said, okay, it's high, hit it low. right?
Yeah.
And that's
Well,
just not.
see, yeah, because chiropractic is designed to open things up and lengthen things. And so if you treat that side that's already too long, you just made it worse.
Mm.
Okay. And so the second part of our program is we have a three-dimensional traction system that can open up only one side and only torque one direction. So everything is really customized, even if you have a counter torque. So if your upper body is torquing clockwise and the bottom part of it is going counterclockwise, we have the traction device that can counter torque at the same time as pushing opposite directions. So we're able to target every tight section without treating the long side.
So how many? I mean, you're talking about. I do two-way traction, right? Where a head is pulled here, another strap is pulled here, then you're bracing here for a sagittal curve. I mean, how
Yeah.
many straps are you putting on someone?
Well, it's not just straps, it's torque pads. So we're actually
Oh, you're
able so
torquing.
we combine torque, rotation, side to side movement,
Mm-hmm.
translation, forward, backwards, you name it. I
X,
mean,
Y,
it's
and Z axis all at
yeah,
once.
it's the whole thing all at once. And
Does
so
it
it'll
tax
unravel
you?
this.
Does it tax you? Are you like, oh gosh, how am I going to get this one?
Does it tax us in regards to is it
Mentally, is
tough?
intellectually, yeah.
You know what's nice is there's only so many curves that the body will position itself into.
Mm-hmm.
And so you're looking at maybe 7 to 10 different setups with
Mm-hmm.
little modifications here and there.
Mm-hmm.
And once you master those, you've got it.
Mm.
But what will get us is the stiffness. And so if a kid's really, really stiff, it can take a few months to really get that unlocked.
I've seen kids come in, they can't even reach their knees.
Yeah, that's the nerve tension. That's,
Mm.
when you bend over, you're stretching your entire cord.
Mm-hmm.
Those are your spinal meningeal tension tests, right? So when a kid comes in with meningitis, that's your test is to bend over. And if the kid can't bend over and it's electric shock like pain, that's their nervous system that's all inflamed and painful.
Mm.
So that's what you're seeing is that nerve tension.
That's amazing.
Yeah.
You're right.
And
So
so number 2 is get the short tight sides open, and that's the three-dimensional traction device. Number 3 is the brace. And so getting that long ligament to hold short is the trick, because ligaments going from short to long can take 2 years. And that's why the longevity of that ligament restructuring is so important to create a permanent change in that kid's spine so it holds forever. We don't just want, hey, you look great in this treatment for 20 minutes, and then as soon as you go home, it's back. And so that's number 3. Number 3 is the best brace that can get you more corrected than any brace in the area.
mm,
And so the better correction you get in brace, so let's say you do have a 45-degree curve, you want to get that thing to 10 degrees, 5 degrees, or even 0 degrees so that patient gets the best result. And a lot of the braces will go from 45 to 35. And that's not nearly enough correction to get improvement. Your
mm.
body just doesn't see a difference between 45 and 35.
So
You got to
while they're
really
in
make,
while they're in the brace, the curve is actually it's gone down.
oh
You've
yeah,
you've reduced the
significantly.
scoliosis.
You have to, otherwise, and that was part of the problem with a lot of the bracing over the decades was, the doctor would look at it and say, "Hey, you're better than 45. You're 35."
Mm, mm,
But there's not a big enough delta or change in your spine to say, "I'm going to regrow at a different position." It's got to be at least 50% better. So if you're not getting a brace, let's say again 45 degrees, if you're not going down to 22 and a half, you're not getting results.
mm-hmm.
And that's where a lot of patients have put their trust in the old system of, hey, I'll get a brace, it'll pop me down to 35. I hope I don't get worse. And they blow right through it. It just wasn't a big enough difference.
Mm-hmm.
Right. And so brace is number 3, exercise is number 4. And exercise,
Are they wearing the brace at home?
yeah,
Right.
yeah,
How much time?
as much as they can.
As much as they
So,
can. They're going to school
yeah,
with it on.
yeah. The research is showing if you wear it 20 hours or more, you're in the tier 1 results. You're going to get some of the best results. If you go down to 16 hours, you're in tier 2. You'll get maybe some results, maybe not. If you're below 16 hours, you're in tier 3. And so you're probably not going to get results. So a lot of times when, the doctor hands the kid a brace and the mom says, hey, how long does she have to wear this every day? And he goes, well, as much as she can. If she's embarrassed to wear it to school, don't.
Oh, no.
Well, he just set her up for failure. And so if a doctor hands you a brace that only corrects you to 35 degrees and you're not wearing it to school, you're going to fail, period. And so we've tried to make it a point in this office to not tell you what you want to hear, not give
Right.
you good news with, hey, you hardly have to do any work and you'll get better. It's more like, hey, this is what the research shows. This is what you have to do to get better. And if you want to rise to the occasion and do it, you'll get the results.
Right. Right.
And so we challenge the kids. We say, look, if you want a better life, do it and you'll get better. You just have to hold the standard.
And you're getting some compliance there?
Huge.
Oh, good.
I mean, that's the other part of the program is, you got to encourage the kids, encourage the parents. When these families get the diagnosis and they're told full spinal fusion and their back getting fused, they're devastated at them. The emotions are high, the tears are flowing, and they want answers and they want success.
Mm-hmm.
And it's tough work.
Right. Right.
Yeah.
But that emotion is motivational.
Oh, totally.
Right.
Yep.
Yeah.
It helps.
It helps.
And so
do you want to get cut from neck to
exactly
the tail? Yeah. Okay.
Yep.
Here we go.
Yep.
Let's do something here.
Yeah. And so when they understand that, they're very motivated.
Yeah.
And so, that fourth part is exercise. We want to strengthen the spine on just one side sometimes, right? So if a patient is just kind of leaning to one side, you want to exercise them to the other, right? Mm-hmm. Other times we want general core strength and just get them stronger, get them healthier. I think that applies to almost every condition on the planet. If you've got heart issues, diabetes, eye problems, joint pain, scoliosis, what do you tell your patients, Adam? Right? Drink lots of water, get sleep, exercise, get sunshine, right? Take your vitamins. It's the same type of program that you would do for almost any condition on this planet. And that's number 4. Number 5 is we have an MRI monitoring system. So we can check all of our work any day, any week, any month, the entire year. And so if we want to ramp up the treatment and go a little bit better, we get the standing MRI that gives us an accurate depiction of what their spine looks like. And so if I want a better brace, I image it, see what I need to do better, fix it, re-image it again.
Are you doing an MRI with the brace on then?
Yeah.
Oh, that's wonderful. So you're not X-raying for the most part?
No. And see, that was the other problem with if we go back to the pediatricians and what they've done for the past 40 or 50 years, is a pediatrician will go into, your annual exam with the kid, and they'll see that little bit of twisting on their spine, and they go, I'm not sure if the kid has scoliosis.
Let me just give this to the people out there because this is important.
Yeah.
And maybe you want to do it with your kids, your grandkids, that kind of thing. Especially the girls, it's 10-1 female. It's you're bending forward, having them bend forward. Just kind of, how do you word it when you tell them to do it?
It's called the Adams test. Just bend over and try and touch your toes.
And then you'll see a little hump on one side.
Yeah, so the back should be level across the plane, and you'll see one side rise up a little bit. And so what happens is when it's subtle, the pediatrician's sitting there going, it might just be a little kid twisting and wiggling. And so why would I want to risk an X-ray on a 9-year-old or a 10-year-old, and then they come back and I look like an idiot?
And you gave them ionizing radiation.
Yeah. Right. And I ended up X-raying a kid. It turned out to be nothing. And what the upright standing MRI allows you to do is fulfill that curiosity without creating any radiation damage to the kid.
Mm-hmm.
And so a pediatrician now can take a 9 or 10-year-old, get a 2-minute MRI, and that's the other thing that's cool. It's 2 minutes.
What?
So
You own this
it's a
MRI machine, right?
yeah.
Wow, you're kidding. How can you do a 2-minute MRI? I mean, they've always been 20,
There
40.
well, those are diagnostic MRIs. This is a quick scan of the spine. It's non-diagnostic, but it gives you the proper angles of the spine. So
Wonderful.
you can, yeah, so every pediatrician now can fulfill that curiosity of, hey, I think this kid might have scoliosis. Let's go check. And then the second thing is now the pediatrician has a place to send to get results. Whereas in the past 20, 30, 40 years, they haven't. So they'll catch it and they say, what do I do now? There's really nothing to
Let's
do
wait
other
for it to
than
get so bad we need to cut.
exactly. And so they wait around until it gets too high, and then they get the surgery. Yep.
Wow. So give me, get us excited about this. I want to hear a testimonial too.
A testimonial from a kid?
Yeah, give me one, like your typical heavy case walks in, number of degrees.
I I think I think the best cases. We just had a case the other week, and so she had started with a doctor. They're from a different state here, and they went to the children's hospital and were told that she'll probably need surgery, and to just come back when she's, I think, 12 or 13 years old. I think she was 8 or 9 at the time when they diagnosed it, and it was already hitting 40 degrees.
40 at 8 or 9.
Yeah, so this is a scoliosis that's going to be a disaster. And so they went to a local chiropractor who did different exercises and adjustments, and like you were talking about, working on the neck curves and things like that. And um, it wasn't working, and the kid continued to get worse. And I'll just kind of summarize this. And so by the time they got to us, just 3 or 4 months later, maybe it was 6 months, it was a 60-degree S curve.
Oh man.
Okay. I mean, and so
Mhm.
the parents are devastated at this point because they understood the higher this gets, the less likely a surgeon can even be
Yeah, can you even do surgery
involved.
on an 8 or 9 year old, considering they're going to grow? I mean, yeah, they're expanding hardware. I mean,
That's for a surgeon to answer, but typically they don't.
they wait
Typically they
until they're
want to,
fully grown.
correct. And so they were kind of looking at it as, let's do everything we can to keep this from getting worse. And it still blew through everything. And so right now, and it's been, I want to say she's maybe, let's see, she came in at 8 or 9. She's probably 12 or 13 now. And she's in the low 20s, high teens.
Mm.
So, I mean, the spine looks fantastic.
Hmm.
In brace, she's perfectly straight. I mean, you're looking at almost 0 to 5 degrees in brace. And what makes that story so impactful is the position that the parents were in, just the devastation, the tears. The
Right.
daughter was crying, and anytime we would do a treatment, she would cry.
Oh.
And man, Adam, 4 or 5 years later, she's strong, she's confident. The
Mm.
parents are just ecstatic that a curve that 99.9% of the time would have blown up into the 80 and 90-degree range by the time she finished growing is sitting there in the teens and the
Mm.
low 20s.
I
That's
love it.
that when you can change someone's life like that, man, it's such a blessing.
Yeah, you're really influencing. Now, how do we know she's going to stay there or be in that range for the rest of her life? I mean, when she stops growing, it's going to stop unless you're getting degenerative changes. You're going to stop going
Yeah,
into
so
that
once
scoliosis.
once the growth stops, the rapid progression of the scoliosis stops.
Mm.
But now you've got the next 70 years of gravity. Okay. So what we'll do is we start weaning the patient off the brace and the treatments once they stop growing. And after 3 to 6 months after they're weaning, we'll start doing longer out of braces. We'll do 4 hours, 12 hours, 72 hours a week, and we'll start to get a feel of how the patient's holding. And so if they aren't holding at 4 hours, we're not going to do a 24-hour out.
Mm-hmm.
And so we'll give them another 3 to 6 months and continue to let those growth plates close and their body to continue to mature. And then we'll do it again. And every kid's a little bit different on that weaning process. And so sometimes they can wean in 6 to 12 months. Other times it can take another 2 to 3 years of night bracing.
Mm.
You know, like just like braces, when you get your braces on. I mean, you have beautiful teeth. You probably had braces,
Yep,
right?
absolutely.
So, and then once you get your braces off, the doctor hands you a what? A
Retainer.
retainer. And he says, wear this at night for another couple years.
Right.
And so we basically do very similar things. And so we'll closely monitor that wean off process and
Mm.
make sure that the kid's spine is holding more permanently before we just let them go off into the sunset.
Right. And now they're doing a lot of core exercises. They're doing side
Yeah,
planks,
they're in shape now.
they're in
You know,
great
after,
shape. They got
yeah,
abs.
once they've been through the program for a couple of years, yeah, they're in pretty good shape.
Oh, that's incredible.
Good nutrition, the
Mm-hmm.
autoimmunity is gone, their blood sugar is stabilized. We redo all the testing to check all the markers for that, for the thyroid and blood sugar, and make sure that they wrap up the program in great shape.
Now, this is just to let everybody know out there. I mean, it seems like, okay, so what am I going to have to do? Hang out with Mike Janzen, every other week for the next till the apocalypse here, till my kids' growth plates close down. But what about what is your process like as far as just number of visits and that type of thing?
So typically when we start, so let's say this 60-degree case, they came in, and a surgical case like that, because they're past 40, we'll typically see them for about 3 weeks. The smaller the curve, the less we have to see you, maybe 2 weeks or 1 week. And so in that case, for 3 weeks, we're conditioning and reconditioning the spine to make sure it's getting looser, it's getting blood flow and oxygen, and getting prepped for the brace and the traction and all the treatments that they're going to have to do at home.
So for 3 weeks, you're seeing them every day. You're seeing them 5 days a week.
Every day, Monday through Friday, 9 a.m. to 4:30. It's like a very intensive
Boot camp.
program. Yep,
Mm-hmm.
exactly. And so, one kid might be 2 weeks, another kid might be 1 week, another kid might be 3 weeks. And so once they have that, they'll have a home program that they can take home and start doing at home for the next 3 months. And in 3 months, we'll reevaluate, get another standing MRI, see how the program went, see what the results are, and then we tweak it again, and we typically make it tougher, right? So we make the brace a little bit tighter, we make the exercise a little bit harder, we start rechecking their labs to make sure that they're doing the proper diet programs. And then every 3 months, we'll do that. And so we'll check them 4 times a year. And those follow-ups are usually 3 to 5 days. So either a half week to a full 5 days, again, 9 to 4:30. And that gives us the ability to customize everything. We can implement a treatment on Tuesday and check to see how the patient responds on Wednesday.
Mm-hmm.
And so by Friday, we've got everything dialed in. They can go home, and we know it'll be successful for another 3 months.
So Easter break, ski week,
Oh
summer
yeah,
break.
we
It's
work all those. 4th of July. We yeah, we work every school holiday. The
right.
only holidays we take off are Thanksgiving and Christmas, and our wives made us do that. So
Right. That's
yeah,
your key time. Me, I'm like, okay, am I going skiing? Come on, girls.
yeah, yeah.
So what a thrill. Now, I know there is some research. In fact, there's a lot of research on scoliosis. You don't do any research. You're too busy as a clinician, right?
Yeah, right. We always want to, but yeah, you know, 9 to 6 or 7 p.m. We're working on cases and working with the kids, and the other thing with when it comes to research is the variables. And so we've talked to different doctors all around the world, and we've told them what we do, and they go, "How are you going to research that?"
Right.
I
Right.
mean,
Research
you got
wants to delve it down to one thing.
Oh, yeah, and so when we say, "Look, one plays off the other," you
Hmm.
gotta address the nerve tension, so you stop the driving force that's causing the scoliosis. Then you got to loosen up the spine so you get a better brace correction.
Right.
And then you got to strengthen it so it holds better. And then you got to test it over and over go again with the MRI. And yeah, you just get to the point where, look, just give us the results when you're done. Just show us the beginning curve and the end curve, and we'll try and figure everything out after that.
Right. I mean, that's it. That
Yeah.
before and after shot. That
Yeah,
okay, here we
exactly.
are. And yes.
Yeah, and is it holding permanently? And so you want the before and after, and then you want the permanency of it.
What's the longest you've looked up a patient, and so, I mean, how many years after you've seen them and they're still doing wonderful?
So one of our original cases, I think, was 2010. And she was, oh gosh, I can't remember the numbers. It was in the 40s or no. It was close to 60. I think it was a 60-degree case, and her name is Kaylee. She still comes back in to get checked here and there, and she reduced to about 18 or 19 within 6 to 12 months, I think. I can't remember the numbers.
Mm-hmm.
So she just came in last year, so 2021, and we did an MRI, and she was still 18 or 19 degrees.
Oh, how
She was
wonderful.
held for 10 years, yeah.
So good. And
So
is
that's
she
probably the
in
longest
pain?
one.
Is she in pain? Is she doing okay?
Well, her spine's fine. She had some other um, connective tissue hypermobility type things where her knees are bugging her because they're so loose.
Mm.
Things that I can't fix, unfortunately. So
Send him over to me.
the spine's doing great. We did our part, but she has some other issues that
Okay.
she's dealing with. But yeah, the spine's doing fantastic.
What a thrill it is to talk to you. And I know you now have an office. You have one here in the Bay Area in California. Then you have another office in, where is it, Alabama or Arkansas?
Oklahoma.
Oklahoma. Okay.
So Oklahoma City should probably be opening fall to winter 2022. So this year.
So you're serving the people more East Coast,
Midwest. Yep.
Midwest. They're
Yeah.
coming
And
there.
then we'd eventually like to be on the East Coast to make it easier for people to get to.
It'd be on the East Coast. Another East
Yeah.
Coast.
So, well, we don't have an East Coast. We have a West Coast here in California.
Mm-hmm.
Hopefully the Oklahoma City will open soon.
Mm-hmm.
And then maybe one day East Coast.
There's only two brothers. How do we do this? We got to train people or what?
We're trying to multiply ourselves. It does take a while to learn everything. Right now, it takes a couple years to learn how to do the process and manage a case correctly.
So an intern chiropractor comes in with you. They've probably already been trained on neurology. They've had all the extra courses. They've studied maybe Pedibon, maybe CBP. And now they come into you. You have to dispel truth into their lives.
Yeah. Well, they have to learn a lot of different things.
Mm-hmm.
You have to learn how to design a brace on a computer system. So you have to be a little bit of a computer guy.
Techie.
And then to make the brace, you got to use jigsaws and pads and heat guns and different sanders and things like that.
Oh, you're literally constructing it.
Yes. Yeah, they're
your
custom.
Oh,
Yeah,
is this your garage?
No, we have a shop here in the office. And so it takes a little bit of hand-eye coordination, and then you're working with a lot of adolescents, so you got to be good with kids. Exercise programs, you got to be good with core and how to properly exercise the body. So there's a lot of different things that go into it.
So why don't you tell people, how do we find you besides looking at Mike Janzen DC?
Well, our website is scoliosiscarecenters.com, and you can find so much information on the website. You can learn more about the root cause of scoliosis. You can learn more about the treatment programs. We've got a lot of results on there, so you can look at the rib humps and the changes in the spines, and just a lot of information on that. We have a blog on the website that answers a lot of questions on genetics. Like, we get a lot of questions about scoliosis being family history. You hear that a lot is, My dad had it, my grandma had it, and I have it. So there's information on that. A lot of the published research, like Dr. Roth in the 60s, Dr. Porter in the 90s, and Dr. Burwell in the 2000s, all talking about nerve tension. And so we have a lot of that on the website if you want more about that. There's information on our brace system and how we do our braces and what makes that unique. So there's just a lot of good information. I would go to the website, scoliosiscarecenters.com.
I think that's a great start. It's a
Yeah,
big time investment. It's a big investment, and it's incredibly worth it.
yeah, definitely.
Any insurance doesn't cover this, right?
It's considered experimental and investigational, and that kind of comes back to your question about how has it been researched. And so individual portions have been researched, like a good brace, like the best brace is going to get you the best results. Traction does a great job on this, and exercises do a great job. But insurance companies, they really don't want to pay for much
No.
these days. So unfortunately, a lot of families just have to say this we want results, and this is what we're going to do, and we're going to do the program.
Right. Well, thanks
Yeah.
for going the next level, digging deep, and helping people
Yeah.
at a new level.
Well, yeah.
Appreciate
Well,
having you.
yeah. Thanks for having me and being able to share the word about scoliosis.
Oh, it's been a joy.
Yeah.
This is it, people. I mean, if you really want to dig down to the next level, most people I know that have healed themselves from a chronic disease have done it by sometimes stepping outside of the normal medical model, right? My YouTube channel with all the self-help videos, etc. We really sometimes we've got to take our health into our own hands. And this scoliosis care, we have Dr. Mike, and we also have, he empowers you. He empowers you to do something for yourself and get a huge victory, right? This is beyond throwing a touchdown pass to win the Super Bowl. This is climbing Everest together with Mike. Anyway, thank you again. And thank you for coming to Health and Care. I'm Dr. Adam Fields. We'll see you soon.